Hey, everybody, it's David. I'm your host of Highway to Health podcast. Thank you for being here. If you've tuned into previous episodes, you know that this podcast, it's meant to celebrate the people, the organizations that have committed to improving access to care, experience while getting that care, and then outcomes. Our providers and our patients are being challenged every day. And we want this podcast to be a way for both patients and providers to learn about the new innovations that are coming to market, to learn about new innovative ways to solve some of these challenges. And then hopefully we're on this open road journey together to get where we want to be in healthcare. We've had some of the best, some of the brightest from every part of our healthcare industry. And our guest today is a perfect fit. Dr. Liz Kwo is currently the Chief Commercial Officer at Everly. But Dr. Kwo she's almost like a Renaissance woman. She's done a little bit of everything, and her rounded perspective is going to bring great value to the podcast and to you, our listener. So thank you for being here, Dr. Liz Kwo. Welcome to Highway to Health.
Thanks for having me. Appreciate it. I would say I'm almost a jack of all trades, but a master of none. So thank you for allowing me to kind of share some of my own insights and what I've done.
Well, the pleasure, the honor is all mine. So thank you for being here. And we're going to get into a lot of different topics. You have some exciting things happening. I mean, recent release of a new book. Congratulations on that. Some really cool things happening also at Everly. So we'll get there. But this is a question I've asked almost every executive that's joined the podcast. And I'd like to get your insight. As an executive, your schedule is so busy, but I'd like to hear a healthy habit, a mental, physical exercise that you've implemented into your daily routine to help you perform at a really high level. Would you mind sharing, something that you do daily to help your physical or mental well-being?
Absolutely. I do a few different things. One is I definitely meditate, and it doesn't have to be sit down for an hour. It's probably 10 minutes, sometimes 20, whether it's through an app or sometimes it's just timed chime every 10 minutes. And it helps ground me to what's my purpose today? What am I aiming for? What are the goals to accomplish? But also, how do I feel good about the decisions I'll be making? The second thing is I definitely spend time exercising, and it could be just either a 20-minute quick workout. Sometimes it's with a friend at a garage. She's converted her garage to a workout place, and we just do weights. We do free weights. Sometimes it's a Peloton, but it's so important to me because I find that it gives me energy. I sleep better with it. And then the third is making sure I do sleep well. And I give myself days where I sleep in, and I make sure that the decisions that I make, I think we've heard Jeff Bezos say he doesn't need to make 1,000 really good decisions. He has to make 10 really good ones. And so I try to focus on what am I supposed to do today to help bring value to the company, to my work, and the people that I lead.
Being intentional with those three things makes such a difference. I could be better in the sleep department. I think we probably all could. But, you mentioned Bezos. Even Elon Musk will say he has to get at least 6.5 hours of sleep. And so if those guys, if those people can find the time, I should too. And that's a good reminder. Thank you for sharing.
Sure.
New book. Tell us about it.
It's the goal for the book is called Digital MD, and it's demystifying the way that we sell and build and scale companies in digital health. I am a physician by training, but I also am a patient. I've been a provider. I'm a physician, but also a pioneer. I've tried to build companies. And on top of that, I've been on the payer side, building companies within and covering innovations that I thought were important to try to scale. Lastly, I've been a pioneer, so called the 5 Ps: patients, pioneers, policymakers, payers, and of course, as a patient, thinking through as a provider, what do I do to support patients? My goal with this book is to help innovators both build within their organizations new ideas, things that are supporting patients, but also those that are entrepreneurs on their own, trying to work with an employer or a payer to scale their companies. And I talk about, and I briefly touch on everything that's out there. So in addition to the 5 Ps of the stakeholders, I talk about the 4 Ps, and generally sometimes 5, of what AI, remote patient monitoring, precision genomics, all this great work that's coming about will support us with. So it's personalized, predictive, preventive, and then ultimately even prescriptive. Why is prescriptive important? As a physician, you know that a lot of new interesting ideas and interventions, even though if they're diagnostic, may not tell you anything that's relevant. Something could say you have a 5 times more likelihood of getting Alzheimer's than an average person, but it doesn't change management. It doesn't change how you live, as opposed to something that's prescriptive that can tell you, with this, you should stop smoking because this actually can shorten your life by X number of years. Or if you did X, or if you tested for this, this will actually put you on a drug that will help extend your life. I think these are really key things that we don't always think about when we're building companies. Who's paying for
Right.
it? How it's actually changing intervention, and ultimately, how are you going to build it to scale it in the right ways?
We could talk about the reimbursement or the payment side of things all day. That's a passion of mine. And even when, going to some of these great conventions or trade shows in the industry, that's often one of the first questions I ask, especially in the med device or the pharma space. It's like, okay, it's a great idea. I absolutely see the application, but who's paying for it? And that's become a bigger, more impactful topic and a lever that determines the success of some companies sometimes. And so I love the way
Yes.
you focus on that topic. In the book, you look at this transformational or transformative power of digital technology. You just previewed some of it. What is the drive? We're in the golden age of innovation, especially in healthcare.
Mm-hmm.
We're seeing adoption of innovative technologies, solutions coming in from even outside of healthcare that's being more widely accepted. What's the driving force behind this transformation, in your opinion, and in your research?
When you say driving force, like what motivates me, or what is causing everything to change so
Yeah,
quickly? Because, there's everything from computational power, right? What we could send someone to the moon is now in our iPhones, in our, it's amazing to see what access to data we have now. There's a lot of integrated models of electronic medical records, plus genomics, plus testing, plus the ability to predict. And so you can see a lot of really interesting ways to discharge someone earlier from the hospital and let them be monitored in the home, or predict that someone will likely have a heart attack earlier than you expected. There's now new testing with regards to something called LP(a). Peter Thiel and some of these other folks in wellness have been championing testing for this, and it's even more precise and interesting than cholesterol and triglycerides that we used to be testing for heart health. There's all this new innovation with regards to what pharma can do to really try to do something called pharmacogenomics, testing you to see what type of drugs you should be on and which ones you metabolize better. There's all sorts of areas of not only remote patient monitoring, but predicting through some type of algorithm where AI is actually saying they're seeing interesting data that shows this type of what they're observing is going to show someone who's going to go into labor earlier. So we're seeing all these really interesting things, but the idea is who can pay for it? And we want to create a world where there's not the have and have-nots, those that can pay out of pocket. Ideally, you create a system that everyone can benefit from the innovations. And so the goal is then, do you first champion it through a certain type of population that can pay for it? It becomes more widely acceptable. There's more data on it. Payers now come onto it and see that it's useful, and then they start to offer it to others. And Medicare is oftentimes, a way that people champion first with med device. And so thinking about these with integrated delivery networks too, on when you're both a payer and provider, that could be really interesting. And then also, how do you think about it from the reimbursement model for those that actually are gatekeepers oftentimes? So physicians, clinicians who are the ones that you want to convince this is the right model. You'll get reimbursed for your time. You're changing your way of doing surgery or your workflow, but this will ultimately save you and the patient's time, and you can still get reimbursed maybe at a higher rate. So getting all the stakeholders aligned to these innovations will be key.
Do you think the alignment with the stakeholders is one main reason we're seeing a wider adoption of some of these innovations? Because, everybody
Yes.
always says healthcare is 10 years behind every other industry. And I I have a problem with that statement because usually people who say that don't understand why. But I do feel like in the last 10 years, 15 years even, the industry as a whole has been more welcoming to these different types of innovations. Do you think it's because of the
Yes.
alignment that we're seeing across stakeholders?
Yes, I think there is extra now understanding. More people are, they're less silos. In the past, it was sort of the payers work on their data. Now they're saying, can we integrate the data? Can we use claims data, reduce total medical cost within the 12-month ROI, but still get a provider to reduce their burnout? And how do we work together so it's not payers and providers saying payers will focus on fraud, waste, and abuse, and thinking through people upcoding, and the provider saying, why aren't I getting reimbursed for this? And creating a better relationship. I think the other thing is that we're able to process data much faster now. Things are moving quicker in the way that we think about getting patients to engage and spending better ways of even something as simple as, does someone want to be reached through SMS, text message versus a phone call versus a live agent versus someone who's an automatic call for reminders? And sort of you think about the digital engagement continuum from sort of passive information that you're gathering to a proactive way to then getting a live person to them being in person. And how do you help people move on the continuum?
Yeah, and I think patients are a big part of the community advancing towards these innovations. As a patient, our expectations have evolved, and now the demand from the patient community is driving a lot of the actions that we're seeing on the provider side or other parts of the industry, because the demand from the patient is the same as the expectation or the experience that they get elsewhere, which then motivates the other stakeholders to align with that demand or that expectation from the patient.
That's right. Absolutely. And I think patients, there's this big concept that was coined by one of my Harvard Business School professors, Regina Herzlinger, about consumer-driven healthcare. And she wrote a book on this focused on how do we get consumers to be empowered to feel like they can drive some of the needs that they are seeing towards more innovation, towards getting coverage. And how do they, if they can't get coverage, how do they work around it? And I think there is a stronger sense of empowerment. We do that at Everly Health. We try to empower people to have affordable, accessible care if they can't get something covered, to go through with a few clicks of a button to order tests that they think they need, to also enter in symptoms so that we can collect, and then we can offer services and offer advice on what we believe you should be tested as a next step. Because, table stakes for virtual care is now everywhere, right? We can get access to a PCP or someone that can see us, but what is the real secret sauce now to allowing that specific visit to be useful is key. Usually it's with electronic medical records, it's with data, it's with lab values. So I think that's the next iteration. Once you get lab values and someone visits and they know you, then they can actually treat you. So it's testing to actually treating.
All right. So let's get into the access a little bit more.
Sure.
On the clinical side of things, we talked about the evolving expectations, but that used to be met with skepticism around, different generations, different ages, different demographics. What are you seeing as a whole on the patient community? Are you still seeing that it's siloed, or it's segmented by age and demographic, or are you seeing that regardless of the age and demographic, this expectation is pretty consistent?
I do think people overestimated the, resistance of remote care, especially for the older generation. People sort of assume that they're less tech savvy, but we have not seen that. We see that they're equally engaged. They may not know as much, they might not consume as much digital information, but they are as responsive to getting testing, especially at Everly Health. We're seeing that. I think the other thing, you mentioned this idea of our patients, do they have certain preferences? And absolutely, from emails to text to phone calls, like different people consume information and will engage in different ways. But the way people are approaching healthcare has really changed. The pandemic has shifted us from a traditional method to, of course, Now you can tell a provider you have COVID and you got a positive test, and they can prescribe Paxlovid over the phone. It's ways to do this now that I think we wouldn't have done this 10 years ago. So there is a change and a shift in people empowered to take tests at home, do their own work. There's also more interest in remote-based care. People are wearing all sorts of watches, rings, things like that, that measure their heart rate, blood pressure, pulse ox. So we're seeing that interest now breaking down barriers for those who reside in rural
Right.
or more urban, healthcare deserts. So we're seeing that interest in not only getting reimbursed, so CMS has now CPT codes for remote patient monitoring, but we're also seeing the ability for people to not only engage, but now know what they need. So there's going to be a continued improvement in innovation. And as more people know that things are available, that their health plan covers certain things or that they can pay for it, we're enabling a sort of an end-to-end care that's, as we mentioned earlier, more predictive, prescriptive, and preventive.
It also becomes less transactional. And I'm not even speaking necessarily about the financial aspect of it. I'm really just talking about the exchange of data and the exchange of information
Right.
between patient, provider, and even payer. Because, these wearables are less intrusive than other forms of data gathering. You mentioned watches and rings and things that are a very light touch that provides very valuable data.
Right. Very light touch. And as you mentioned, the continuum, it's very passive collection of information. You don't have to really do much, which is great, right? It changes the whole myth of people having to be majorly engaged. And some of these can become sort of one size fits all to support multiple use cases with one product.
How has this impacted the provider or the physician expectations? This is what I love about our conversation. You've worn almost all of these hats that we're talking about, maybe all of them. So tell me a little bit about how, as a patient, that's kind of where I default, right? Because not only am I a patient, but I have 4 kids and a wife that are also patients, and my parents are getting older. And so I think about it more predominantly on the patient side of things, but this is impacting the provider and the physician in a real way. Would you share a little bit about that side?
Absolutely. I think physicians are increasingly seeing people ask them all sorts of questions. I saw this ad for X, or I'm now using this remote patient device. This told me I had this arrhythmia. And I think some of it is very useful because clinicians now have extra data. I actually have patients come to me sometimes with a list of things that they want to talk about, and they actually have data to support it, and they'll show me what is tracked on their app. I find that useful. I think sometimes, though, some clinicians get overwhelmed because it's a lot of data and some of it is noise. So it's the job of a clinician these days to really parse out what's noise versus what's actually clinically relevant. And it also entails us knowing more about technology, what's out there, what are people reading and doing within their specific specialty, whether it's, cardiac or kidney or pulmonary and lungs. We are now seeing all these really interesting models of people managing their asthma remotely and paying for things out of pocket to do that. I will say, from a clinician's perspective, we are now also being asked not only to look at some of the data, but also start to remotely monitor. And I sometimes get patients sending me interesting information, even via email, to my work account. And what I'm also wary of is not only data security, but also what's my responsibility in responding to these. So we're also seeing a shift now towards more concierge care for those that really want the high touch, open discussion, more wellness driven, less just screening for what you should be screened for at your age demographic, but focused on all the questions that people have. And I think there's room for it. There are actually quite a few companies now building out for $500, $1,000, actually pretty expensive, but you can get screened for a pan screen of an MRI head to toe, or you can get all these lab tests, and it's done annually. So there's a shift in people wanting to demand this type of service. And I would say from a clinician's perspective, we're now being asked to look at that too And I think it's a good thing. It's changing our ability to now get the data and learn from it. But I do think it contributes to somewhat to burnout. And I think it's a clinician's job sometimes to push back if they don't think it's relevant, and or to say, this is great. I'm happy it's helping you. It's educating you. From this, for the sole purpose of this call today or this conversation, let's limit it to these 5 things that you want to talk about, and let's follow up. So there's a bit of tension, but I think it's a healthy tension.
And it drives opportunity because, there's a whole community of entrepreneurs out there that are looking to help,
Yes.
normalize this data, collect, normalize, and then communicate this data in a way that's really helpful for the patient, for their self-responsibility and their ownership of their own health, but also for the provider and the physician side of things, because you're right. I mean, there is so much stress on our physicians. We've all heard about it. It's probably the biggest, scariest topic in healthcare right now is what, our physicians are going through in terms of burnout. And so that just tells me on the entrepreneurial side of things, there's an opportunity there. And I'm sure you've seen, Everly's a great example of this. And that's kind of where I want to go next with this conversation is, specifically around diagnostics. You're seeing incredible changes, incredible improvements, adaptations in the diagnostic space. How are we seeing access, experience, outcomes improved in diagnostics?
We see it every day in the ability for now, not only folks, any of the patients that are curious about their own body and health, to start to, say that I've read up about this. I actually do think I should get an A1C test. It's interesting because if someone doesn't have a primary care doctor, it's a diabetic A1C test isn't always top of mind. People aren't always testing to see if they have blood sugars that they should be managing. We see that actually in our own employees, people getting diagnosed because they're doing a testing with us and realizing that they're pre-diabetic and that they should be on metformin or other key things. So I would say we are now changing the way that we consume healthcare. Sometimes an MRI or a colonoscopy you need an actual physical location to go to. People don't always have the time. But if they have time to order with the click of a button online, get the test, put it in the mail, send it back, get the result, it's a much faster, streamlined process. You're seeing that also in precision genomics. There's a lot of really interesting companies now saying you should test for this. You should have this test to figure out which migraine medication you should be on. I think we're going in that direction. And I would also mention that not only is diagnostics important, it's also what you do with that information, going back to prescriptive. So not only just testing for it, but what are next steps? How do you get educated? How do you take matters into your own hands and not worry? And in the past, it's funny, my husband and I also have a slightly different take. We're both physicians. He thinks sometimes people overtest. I think people undertest. And it sometimes depends on how you actually manage that information, so that it doesn't worry you, it doesn't create anxiety, but it gives you the feeling of feeling empowered. And I like to learn more. I want to know more than less, usually. And I encourage people to do that too.
I do too. And it's probably different for most people. And it probably falls on, your personality or your characteristics. But I worry about the unknown. And if I'm empowered as a patient, just apply this to really any other area of your life, like finances.
That's right.
If you don't know how much money's in your account, you don't know how to manage it. You don't know where you can spend, what investments you can make. You don't know how much you need to save. That analogy, I hope that analogy is applicable to how we're seeing the patient being more empowered with this information through increased access to diagnostics and other types of remote care.
I think there is a way to do it that is mindful and thoughtful, so that before you get the results, like if it says X, this is what I would do. If it says Y, I would do this. Sometimes there are something called false positives. where, it's depending on in epidemiology, we talk about if you get a false negative, it rules out things that you should be aware of, versus if it's a false positive, means you shouldn't not be following up. But let's say you had an MRI and you saw a small lump. It was probably nothing, but now you screen for it and now you have to follow up on it. There is sometimes over-testing that can occur. So I would say, when most people are testing for things, to make sure that they know what is important to actually just keep top of mind, and what type of personality, like you said. Some people are more prone to feeling more anxious when they know more. I tend to just want to know and just hold on to that information. And so my mother had breast cancer. She also has other cancers. And I think for me, I do testing. I do actually an MRI and a mammogram every 6 months because I'm such high risk. And so for me, it's really reassuring to know that I'm getting tested. For others, sometimes they delay care and so delay testing. And we're actually seeing that even with colorectal cancers. People are older, actually they're younger now when they get tested for sometimes diseases that we thought were usually in the older population. So even we're seeing on the U.S. Preventive Task Force, they actually lowered the age from 50 years old now to 45 because they think we should not be screening at a younger age. And so I, with that guideline, now encourage people to also get tested, especially if you have concerns, especially if you have family history and things like that, which is why also medical records and all these ways of tracking your social family history is really key.
And that information is even more readily available for the provider to understand, but also for the patient to understand through it. Just some of the great innovations that have come to market. Yes. And, at the end of the day, I think the piece of advice or the call to action here is to just understand as much as you need to be there for those that depend on you. Whether it's friends, loved ones, whatever, the innovations, the empowerment that's being brought to the patient, almost drives responsibility. And it can, there's a carrot, there's a stick. I see it as a carrot, see it as an opportunity to live a higher quality of life for a much longer time and to take advantage of, the information, the data that's available to you.
That's right. Absolutely. And also, I think when we're able to track this information, I even track how much I use my iPhone. And I now look at my screen time use. And so I make sure that I am not over consuming or under consuming, especially, or some days I think it's better to just put my phone away. But, I think it's important for us to be aware of how we're tracking that information, the data. If you get tested, also it's having longitudinal care. So following up and seeing, where's my A1C for diabetes going? Is it trending upwards? Or is it trending downwards? And we're not always that keen to follow up on things if we don't know what the consequences are. So I'm also seeing something that I've been pushing with our team, something called for end-stage renal disease. You can actually now screen for chronic kidney disease that leads to a dialysis requirement if you're stage 5. So you can be at different stages depending on your health, but 90% of Americans that have it don't know they have it. There's about 37 million Americans are at some stage between stage 1 and 5. And so it's one of those things where I encourage testing, because then you may need to control your blood pressure better. You may need to be better at managing your diabetes, because you don't want to have to, at the end of all of this, after 5 years of having where you could have tested 5 years ago and been able to control it better. We saw that also with Tina Turner. She actually mentioned this. She wished she knew that lack of blood pressure control led to her end-stage renal disease, unfortunate, I would say, consequences of that. So making sure we educate patients at the right reading level, at the right educational level is also key.
Yeah. Health literacy is another topic that we could discuss, because how do you get that information in a form that is understandable and relevant to the patient who, look, I've been in healthcare for a little while now, like 12, 13 years. you're obviously well educated in the space. Not everybody has the luxury of that experience. We've got to get this information to these patients in a way that's understandable and actionable. And I think that's another challenge.
Mm-hmm. And also the challenge is also your network. I feel very grateful. I'm a physician and I am oftentimes on call for friends and family of specialists. Do you know a dermatologist or a this or a that? We don't always have that access as people that may not be in the healthcare. So I think I actually do really appreciate the fact that we have ChatGPT and other things now that you can actually search for things because it's already passed all the medical boards. So it's almost as good as being a physician. Although Dr. Google and ChatGPT isn't always entirely accurate. I do like that we now have people that can ask questions and can sort of streamline their diagnosis. But the network effect of being able to find someone is also something from a payer perspective, I think is really key to increase access. You don't always have the ability to find the right folks and then also get the right care at the right time. Waits are oftentimes long. And I think we're a little bit better than Canada, but as I've heard, I've talked to multiple healthcare providers in Canada, but every system has its own issues. But like you said, I'm very bearish on what we can do within the U.S. healthcare system to improve it.
Tell me, so you named a few things, and there's, I'm sure the patients or the listeners out there are wondering, okay, where can I start? So there are definitely some like certain specialties, certain services that lend themselves better to at-home or remote care. These share with our listeners, what specialties or services naturally lend themselves to alternate locations of care. Which ones are they? And then, why are those specialties better suited for, this increased access?
Yes, I think some are focused on the ability to do diagnostics remotely. And so I think what it is like the continuum. You can diagnose a bit of things at home for certain specialties, whether it's dermatology or even simple things as cardiology, where you're monitoring by a watch. It might not be FDA grade approved, but it can still, even our at the Apple Watch can actually detect AFib, right? And it's like these are things that are kind of I would say more consumer level, not necessarily like medical grade, but that can actually signal for folks that you may want to get this checked. Sometimes it's noise. Like we mentioned, there are a lot of false positives, but I do think it gives people at least additional data. I would say there are all sorts of areas where home testing is possible. We mentioned this kidney test that we actually have now for Everly Health, and I think it addresses a really important population that typically goes underserved and is not always aware. So we try to educate when someone gets a positive test for chronic kidney disease. And there are certain things where you can test for whether it's cholesterol, diabetes, even things like food sensitivity tests. So meaning someone who may not have 3 months to wait with a gastroenterologist, but they sometimes get upset stomach. They're trying to figure out how to eliminate certain products, certain foods from their diet. And it's a great one-way test to just order it, take it, and eliminate certain things from your diet to see if it works out and to see if you feel better. So there are definitely those areas. I will say specifically for AI, a lot of people ask me about this from the provider perspective. Where is AI going to start to take over? I think there are some key areas, whether it's pathology, where it's image recognition, to radiology, where that's image focused. It's going to augment the way that current providers are looking at it. It could say, well, compared to the last 3 scans, we're noting this this area of change. So it can actually highlight things. I think you'll still need a provider to use a clinical assessment to say, well, they recently experienced these symptoms, and with this might be the change that's causing these symptoms. I do think with diagnostics, it is really changing some of the ways that we are identifying why someone is admitted to a hospital, why they're not doing well. But I think for the long-term goals of healthcare, we're still going to need providers because ultimately patients trust human. And this is why I think still take some time for AI to get to that
I
level.
agree. And if you talk to a radiologist, the artificial intelligence that's being added to these technologies, when they're looking at an image, 80% of the time they see nothing. 20% of the time, they do find something. If you ask a radiologist, it's not the 20% that keeps them up at night, because if they identify something, then they can coordinate care. They can put a plan of action in place. It's the 80% that keeps them up at night. They're scared to death that they miss something. And so artificial intelligence is helping physicians, just perform at an unbelievable level, but it's also helping them with their quality of life, which I think is so powerful.
It's so true. Yes, I think not only to think about AI to help tailor treatment plans based on individual patient data, like we talked about genetics, lifestyle, environmental factors, the customization can really lead to more effective treatments, knowing how the person's behaviors are, and lead to better outcomes. There's also operational efficiency within the provider network, streamlining administrative tasks, thinking about billing and scheduling and managing patient records. We're also seeing a push to prior authorization, where instead of waiting for faxes, which some hospitals still do, I still have faxes. Sometimes I have to send in. You're able to automate that and say someone listening in, like let's say the voice recognition is listening in. You check the box for knee injury plus physical therapy was done, 5 weeks unrelenting. You also saw the X-ray and it didn't show anything. Next step, after 5 weeks, it is an MRI now. So making sure that the prior auth is streamlined saves physician's time, saves patient time. We're seeing a lot of that now too, even with wearables we talked about earlier, integrated with AI to alert healthcare providers on potential issues. So I think the world is changing very quickly on how we're thinking about predictive analytics and how we're going to consume healthcare.
Before I let you go, you touched on something that I think is in your book that I think is relevant to our listeners. So we've talked about access, experience, and outcomes, patient, provider. Let me ask you about health tech financing without giving too much away, because maybe use this as like a trailer, a teaser for somebody to go get your book.
Sure.
What are some of the biggest myths? What is maybe one of the biggest myths about healthcare tech, health tech financing for those entrepreneurs that are out there that are listening?
And are you talking about any stage of company?
Early stage, yeah.
Okay. I think we think that sometimes there's a one-size-fits-all business model. What I think most entrepreneurs need to know is who's ultimately where they're going to scale to. So is it the Medicare population, and what specific population is this addressing? Is it the quality side? So quality metrics meaning HEDIS stars, or is it more on reducing medical costs? Those are two different things. Or is it that there's a champion for Medicaid, and Medicaid is usually more focused on women's health. It's OBGYN, it's sort of maternal health, but it's also mental health, and then it's pediatrics. And state by state is very different in sometimes what they're focused on for that, I would say, year or month. So being as direct and focused versus if it's an employer, the 12-month ROI is not as stringent. You can actually think about it more in 3 years. And sometimes the goal for them is access, affordability, ability to not miss work, increasing productivity. And so I think the first thing I always ask entrepreneurs when they ask me early stage is, who is this addressing? What's the business model? How are you going to get either providers to, what's your sort of pipeline? Are providers going to be the ones that are pushing for this? How are they going to get trained if it's med tech, med device? Who are the incumbents? Why would they switch to you? If they're already in device companies with Stryker, Medtronic, why are they interested in moving into your innovation? And an FDA approval doesn't symbolize any commercialization possibility. So being very direct and focused, I think, is key for this type of early stage discussion. I think the second myth is a lot of people think bypassing intermediaries can reduce costs, but it's not always the best approach. Like, some health tech solutions benefit from partnerships with traditional providers, insurers, pharmacists, like large pharma. So making sure you create alliances, I think, is really important. And then also some of it is there's a direct-to-consumer way, and that's definitely true, whether it's patient advocacy groups or others, but it's not the only path. And so I'm seeing now people actually go directly into payer commercial side of the business. So understanding also the difference between fully insured kind of commercial business versus self-insured is also key for people to try to position themselves in the right way.
This community is the entrepreneurial community in healthcare. I love the spirit, and I think there's so many of them that see healthcare as a huge opportunity, but obviously financial opportunity, but also just a way to make an impact. And I think we all as humans look for a way to make the world a better place, right? I mean, we're always, you go work for MarketScale, my employer, and it's like, okay, what's the mission of MarketScale? We want to be connected to something larger than ourselves. And healthcare innately has that built in. Where I've seen challenges hit these early stage companies is exactly what you just described. Not only what problem are you solving, but what's important to that organization. If it's a provider, if there's no margin, there's no mission. You have to be very aligned with what that reimbursement strategy, structure, and outcome is going to look like, and who is going to pay for it. When you're working with employers, you just described it. It's a different structure. It's a different mechanism or lever.
Completely different.
The more these entrepreneurs, these innovators, these disruptors can understand that dynamic, I think the quicker, the more effective, the bigger impact they're going to have in this industry.
Yes. I mean, exactly what you said, because healthcare's end user sometimes isn't the person that's purchasing. It could be a mother who's doing it for their child. So how do you get to the mother or the parent or the father first, or guardian? You're also thinking about healthcare providers. They're key stakeholders in the adoption and success. So even if it's the end user that's advocating, are they willing to get the reimbursement through you and change their complete workflow that they've had before for innovators that are just coming in? And it's also very interesting to see when tech-savvy populations might be early adopters. Health tech solutions are actually designed to be accessible for a lot of demographics. So if you design it correctly, there are great ways to kind of service different specific demographics. And then ultimately, I think, you mentioned this idea to be really mission-driven, to really focus on the company that really drives you. I love what I do because I feel like I'm serving a larger population that I would otherwise be able to do being a doctor 9 to 5. And that really drives me to try to make sure I'm doing the right thing for my patient and for those that we serve. And I think we're lucky in that we're naturally in a career that serves people. And I think a servant leader is key especially in healthcare.
Thank you so much for being here.